Hi, I'm Dr. Tash. In today's episode, we'll be talking about metformin. Before you start taking metformin, it's really important to address your lifestyle. Make sure you're eating well, that you're getting enough rest, enough sleep, that you're exercising. Minimize stress. Enjoy life and have fun. Metformin is an insulin sensitizing drug. It's used commonly for the treatment of type 2 diabetes and helps control blood sugar levels. It's also used for the treatment of polycystic ovarian syndrome, PCOS. Metformin drops blood sugar levels. It can cause what we call a hypoglycemia. This doesn't happen that often, but it's more likely to happen if you're not consuming enough calories or if you're over-exercising. When you're taking metformin, it's really important to watch your alcohol consumption because alcohol also drops blood sugar levels. So it's really important that you watch your daily intake of alcohol and avoid binging on alcohol. Metformin can also reduce blood pressure and lower cholesterol levels. Interestingly, type 2 diabetics who take metformin are less likely to develop certain cancers. Metformin is easy to take. You take it orally. You start low dose and build up to a maximum dose under your doctor's supervision. Metformin does come with a few side effects. Most commonly, they're gastrointestinal, so gut upset, passing, lots of wind, burping, abdominal kind of distension, a bit of pain, and diarrhea. Metformin is often used as part of an IVF cycle to avoid one of the complications of IVF called ovarian hyperstimulation syndrome. Another word for that is OHSS. Metformin is cleared from the body by the kidneys, and when a patient has poor kidney function, the metformin can build up in the blood and cause a rare but serious condition called lactic acidosis. Metformin is often used as part of the treatment for PCOS, polycystic ovarian syndrome, as it can help make cycles more regular. One way that metformin can help improve insulin sensitivity is that it helps skeletal muscle take up glucose for use. Nausea is a common side effect of metformin. One way you can avoid this is by taking metformin with food. Metformin significantly improves ovulation rates. Overweight and obese women, however, do need higher doses for metformin to work. If you are pregnant and taking metformin, the decision to continue will be individualized by your doctor. Metformin makes several tissues more sensitive to the primary effects of insulin. These tissues include liver, skeletal muscles, fat, ovaries, and the endothelium of blood vessels. If you're on metformin, it's important to avoid the use of supplements that lower blood sugar levels. You don't want your blood sugar levels to become too low. If you are taking supplements, make sure to tell your doctor. Metformin also reduces testosterone levels in the blood, and in some way this may help reduce excess hair growth in women with polycystic ovarian syndrome, although it's not the primary reason why a woman would go onto metformin. Taste. Metformin can leave a metallic taste in the mouth. Some people, when they're taking metformin, are more sensitive to the light. We call that sun sensitivity. Some of you may need to avoid being in the sunshine for too long, and if so, it's important you take vitamin D supplements. Another common side effect of metformin is nausea, and with it often goes vomiting. Vitamin B12. The hand that writes the script for metformin should write the script for vitamin B12. Why do I say this? Because patients who are on metformin are more likely to become B12 deficient. What's the big deal about B12? Vitamin B12 is very important for the normal formation of blood cells and very important for maintaining nervous system function. It's very important that if you're on metformin, that you have your B12 levels monitored. Some of you may need supplementation, that is oral or injections of vitamin B12. B12 is also super important for the development of embryos. So if you're taking metformin because you've got PCOS and are trying to fall pregnant, please keep this in mind. Vegetarians, vegans, please take note. B12 is found in high amounts in meat. So if you're not eating meat, you may be B12 deficient. Even more important reason, to get your levels checked and to be on supplements if need. If you're on metformin, you might find yourself losing weight, and you may lose more weight with exercise. And hence it's important to always exercise in addition to taking metformin to help improve your insulin sensitivity. Thank you for watching Dr. Tash TV. I hope you've enjoyed this episode. If you have, please share this video. Please subscribe to my YouTube channel so you don't miss out on any future goodies. And until the next episode, be well.